The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Sweaty and pissed. Menopause makes me sweaty and pissed.
Hello again, my darling.
Hello, Leanne.
Hello, it's me and I'm Leanne Morgan. This is Karen Nickell,
are
and we're
you?
doing Sweaty and Pissed, Menopause and More.
Yes, Leanne doesn't even know who she is. She's
I
been
don't know who
traveling
I am.
She doesn't know what time zone she's in.
I don't.
I know.
But thank y'all so much, everybody, for listening and all the love. And everywhere I go, people are telling me how much to tell Karen how much they love her. So thank y'all so much for listening.
Yes, indeed. And I want to thank, because I always tend to forget at the end of the podcast, but I want to thank Forrest Wenzel, our producer, writer of our theme music, and Stephen Brown, who did our artwork for the podcast.
Yeah.
So,
And my baby who said, Mom, you're sweaty and pissed all the time. Why don't you name it Sweaty and Pissed?
yes, exactly. Thank you, Tess.
Thank you, Ted.
And so we're going to talk today about lichen sclerosus. Someone on our Facebook page asked us if we could talk about that. And it is pretty common, so I thought it was a really good subject, and I thank our listener for suggesting that. Do you know what lichen sclerosus is?
I don't.
Can you guess?
Sclerosis, is that some kind of skin thing?
Yeah, so it's stiffening. Sclerosis means it's gotten stiff.
Oh.
The skin.
The skin has gotten
well, anything
stiff.
any tissue can get stiff, and it's sclerosed. Yeah.
Oh.
So.
And then lichen, I don't know.
So this is a condition of the vulva. Usually happens on the labia minora and sometimes on the labia majora. And it is when the tissue becomes thin and stiff and usually loses its pigment, so it's whitish in color. And it can cause a lot of itching and pain with intercourse. And besides the fact that it's very bothersome, so it needs to be treated, it can it can become cancerous, specifically squamous cell carcinoma.
Oh my Lord.
So it is a precancerous condition. So and it's not that all people who have lichen sclerosus end up with squamous cell carcinoma, but it can turn into squamous cell. Is that my phone?
I don't
Your
know.
phone?
If it's mine, I apologize. No, it was not mine, little Karen.
Oh.
So we're talking about the doings.
Yeah.
And
Back to the doings.
I know can we back up a minute? Because Karen wanted me to be surprised by this, and I am. I really am. So how does one know what in the world? Okay, so women is it menopausal women?
It is mostly menopausal women, and it's a thinning of the skin. There's inflammation of the tissue, and it can occur in other parts of the body, but it's pretty uncommon. It's mostly in that vulvar area. So there are the women are obviously more likely to get it, and
because we have a labia.
Yeah, because we.
Okay, so what in the world causes this?
Well, there seems to be a familial aspect to it. If you've had, father, mother, son, daughter who've had this condition, twins, you may be more predisposed to it. People with autoimmune disorders are more likely to have this problem. Sometimes just trauma to the tissue will trigger it. So there are certain populations that are more likely to develop lichen sclerosus, and it really is a a very bothersome problem.
It sounds horrible.
Because what happens too is it's very itchy, and so people scratch all the time, and then we can get lichenification, which is where the skin thickens because of scratching. So it's a strange little combination, because you got thin skin, which is how the problem starts, and then the skin thickens because of scratching. So yeah, and so it's a real problem, and I see it pretty frequently.
You do?
Yeah. Hormonal, obviously the hormones are a factor. Not having estrogen, these are tissues that don't have very much estrogen, so certainly addressing lack of estrogen in the vaginal area will help, or being on hormone therapy will help prevent it. But
well, praise God for that. I had put on my estrogen cream this morning. Click.
And that they think too that there might be some connection with infections, like the infection from the bacteria that causes Lyme disease can be a trigger, and HPV, human papillomavirus, which we've talked about on other podcasts, can be a trigger. So yeah, it's just
a booger.
It is a booger.
Okay, so somebody comes into you and they say, "This is what's happening to me." What are those things that people come in and say to you?
They might say, "I have a lot of itching." Well, lots of times I just see it doing
when you do a pap.
Yeah. Mm-hmm. Yeah.
Do my doings look all right?
Yeah. As I recall.
Oh,
as I recall,
because I got enough problems. I don't need my doings to thicken or thin. Okay. So you see it.
Yeah.
And then people are itching.
Yeah. And so, and the problem too is if it's untreated, obviously you can have a lot of pain with intercourse. Sometimes that tissue around the opening of the vagina gets so stiff that it will tear and fissure during intercourse. So,
oh my Lord.
Yeah, because it's very weak tissue, So, and we do have treatment for that. So it's important, if you have those symptoms, that you seek help and get treatment, because our first line of therapy is our topical steroids. Typically we use clobetasol cream, and actually ointment is better because the cream can sometimes be irritating for people down there. So clobetasol ointment is probably a better option. And you want to use that. We use an intensive treatment initially, and then we taper it down and then put people on a maintenance level. Because ironically, here we're dealing with thin skin there, and ironically, topical steroids can thin the skin. So, we have to dose it in a way that we prevent that. So we usually dose it twice a day for the initial treatment is going to be like 6 to 12 weeks. So you're going to do it twice a day for 4 weeks, and then like every other day for 4 weeks, and we in that kind of tapering fashion. And then usually we have people use it maybe two times a week thereafter, just to keep it under control. And when we dose it, we instruct patients to use a fingertip unit, which is, if you look from your fingertip to the first knuckle, that first crease in your finger, and you squeeze a ribbon of ointment between the tip of your finger and that first knuckle, that is one fingertip unit.
Oh.
So we'll usually use a half a fingertip unit. So you squirt the cream in a ribbon to about halfway to your first knuckle and apply that. So, and there are a couple other steroid creams that we can use, but clobetasol is usually the go-to. The other option is if you don't want to use a steroid cream or can't for some reason, We do use products like Elidil, which is not a steroid, but we use it. Elidil was developed for eczema.
Mm-hmm.
So it's a non-steroidal cream that can also be used for lichen sclerosus. And so you don't have the thinning concern, so you can use it more readily for longer periods. But the clobetasol is really the best treatment. Sometimes if things get really thickened, the skin gets really thickened, sometimes you have to do injections of steroid into the tissue to correct that. But it's sort of a long-term problem, so getting on a good maintenance regimen is really, really important. But, yeah.
Well, I know we've said this early on in the podcast. It's no wonder that you go through middle age and people used to go out in the yard and just die. Because, that sucks. To think what else is going to happen.
Well, and it's good for people to know about it because they might think they just have a yeast infection.
I know. I was going to
something.
say I've never heard of that.
And that's honestly, if you use clobetasol ointment or you're prescribing that for someone for lichen sclerosus and they're not responding, then you want to think about a mycotic infection, a yeast infection of some sort, fungal infection, rule out cancer of the vulva. There are other things that you need to rule out. And most of the time that is best determined by doing a small biopsy, a little punch biopsy, and figuring out exactly what you have if clobetasol is not correcting it. So it's important when you're being treated to use the medicine as directed so you get optimal benefit. Follow up with your provider, and if it's not improving, then a biopsy needs to be done to make sure there's not something else going on. But as I said, a lot of people think they just have, they'll use a lot of over-the-counter antifungal products thinking it's a yeast infection.
Mm-hmm. Monostat or something.
Yeah. So if you get a mirror and peek down there, if the tissue's white and feels sort of stiff and it's a little wrinkly, then you should see the look on Leanne's face right now.
I think mine's probably wrinkling at this point.
But really the whiteness of the tissue is the telltale sign. But especially if you have a lot of itching on the outside, especially because a lot of times with yeast infections, it will feel itchy inside too.
Yeah. Well, I hope if people out there have that you get some help.
Yes, and I want to thank the listener for bringing that up, because that's, I think, because there are a lot of women who aren't getting regular GYN appointments, and especially as we age, they tend to be less likely to go in and have a GYN exam. And now with our guidelines where you can go 3 years without a PAP and no PAP after age 70, this can happen and be going on, and nobody's ever looking there to see if the tissue's healthy. So
I'm not giving up my PAP.
there you go.
I'm not. My yearly.
Well, and my women who have aged out of a PAP, or where we can only do a PAP every 2 years with, for instance, with Medicare, or now Humana, commercial and Medicare, they only pay for a PAP every 3 years. A lot can happen in 3 years. So typically I will bring those women in annually for a GYN evaluation, and I do a breast exam and a pelvic exam, and look at the genitalia and check for lesions and lichen sclerosus and
Yeah.
whatever else. So
Well, you're very thorough. You are.
try to be.
You
So-
are.
So if you have any of those signs or symptoms, get it checked out with your primary care or a GYN, and because there is treatment and it can get better.
Hallelujah. All right. Well, is that all you've got, my darling?
That's all
on
I've
that?
got for lichen sclerosus.
All right. Well, thank you very much.
You're
and
quite welcome.
we'll get y'all next time.
Yeah, thanks
Thank
for
you.
joining us.
Okay. Bye-bye.
Bye.
Sweaty and